Hello viewers, welcome to Nursing Tutorials with Jamila. Today we are going to be looking at the ovarian cycle. Now the ovary is the female primary organ of reproduction. It is 4 cm in length, 2.5 cm in width and 1 to 1.5 cm in thickness. It is pear in shape, one on each side. It's made up of 2 layers, the cortex, which is the outer layer, and the medulla, which is the inner layer. Now the cortex is the functional layer of the ovary because it contains the follicle, and the medulla is the supporting framework. It contains the blood vessels, the nerves, and the lymphatics. So we're going to be looking at the ovarian cycle on the diagram as I go along with the explanation. The ovarian cycle is being regulated by the hypothalamus of the brain and as well as the anterior pituitary gland. This is the anterior pituitary gland, and this ovarian cycle is divided into 2 phases. The first half of the ovarian cycle is known as the follicular phase or pre-ovulatory phase. While the second half is known as the luteal phase, or you can call it post-ovulatory phase. And during the fetal development, the ovary contains follicles that are not matured. They are known as the oogonia. As the individual fetus continue to grow, this oogonia develop from oogonia to primordial follicle. This is a primordial follicle, mordial follicle. Then the primordial follicle further develop to become the primary follicle. The primary follicle also develop and become the secondary follicle. Then the secondary follicle develop to a matured follicle, which is known as the Graafian follicle. So looking at the follicular phase, it is being regulated or controlled by the hypothalamus. Now the hypothalamus usually release what we call the gonadotropin releasing hormone. It is now this gonadotropin releasing hormone that stimulates the anterior pituitary gland to release a hormone known as the follicle stimulating hormone and Lutuenizing hormone. These are the 2 hormones that are being secreted by the anterior pituitary gland. Now the follicle stimulating hormone, as the name implies, stimulates these follicles. It stimulates the growth and the development of these follicles. So once the follicle stimulating hormone is released, it stimulates the growth and the development of the follicles that are in the cortex of the ovary. Now, looking at the matured follicle, it contains matured egg. It contains an egg which we call the oocyte or ovum. Right here. Okay. Now, the follicles also contain some cells known as the Theca cells and other supporting cells. Now these Theca cells are responsible for the production of estrogen and progesterone. Estrogen and progesterone, they are they are produced by the Theca cells that are present in the follicles. Now, these two hormones that are produced, they help in maintaining the endometrium of the uterus. They make it to thicken and then further thicken in order to prepare for pregnancy. So this is it pertaining the estrogen and progesterone. Now, with continuous release of the follicle stimulating hormone, these follicles have now grown to a matured follicle, and it contains the matured ovum. So the matured ovum now has the two the matured ovum is now ready to be released. So with the continuous production of estrogen and progesterone by the Theca cells, as this level of these hormones rises, the message is sent to the hypothalamus of the brain. In response to the level of estrogen, the hypothalamus will now stop or inhibit the release of follicle stimulating hormone and luteinizing hormone. So with the inhibition of the release of these two hormones, the follicle stimulating hormone and the luteinizing hormones, there is restriction in further development of follicles in response to the level of these two hormones. So the follicles do not continue to form, develop, and mature. Now, the restriction or the inhibition of the follicle stimulating hormone and the luteinizing hormone will now lead to a drop of the estrogen and progesterone level, which now initiates what we call ovulation. So the Graafian follicle now attaches itself to the wall of the ovary, and then it releases the matured ovum so that it can be cut off by the fibria of the fallopian tube. Now, once this matured ovum is released, the follicle that ruptured will now close itself. It will fix itself, and it will become filled up with blood, and it will now become corpus hemarrhagecum. Corpus hemarrhagecum. As the corpus hemarrhagecum continue to undergo physical changes, it will now become filled up with a yellowish substance known as the corpus luteum. And this corpus luteum will continue to produce progesterone because it's being regulated. The whole of this phase is being regulated by the luteinizing hormone. So the corpus luteum will continue to produce progesterone in a higher level, while the estrogen is in a lesser level, that is a lower level. So the progesterone will continue to maintain and prepare the endometrium of the uterus for pregnancy. Now, when fertilization occurs, the corpus luteum continue to produce this high level of progesterone so that the pregnancy can be sustained for a time until the placenta is formed and it can perform its function of formation of the progesterone. When there is no fertilization, the corpus luteum degenerates. It undergoes physical changes. It degenerates and becomes corpus albican. And this corpus albican undergoes atresia, which is a process of degeneration, and it's become atretic follicle. And the atretic follicle is now later absorbed by the body. Then the decrease in the level of progesterone produced by the corpus luteum as a result of the degeneration will now send information to hypothalamus that there is low level of progesterone. So the hypothalamus will now release gonadotropin releasing hormone, which will now stimulate the anterior pituitary gland to produce follicle stimulating hormone and luteinizing hormone, and the cycle continues. It begins again. We have the formation of the follicles, the development, and then the matured follicle will now be formed, and that's how the cycle continues. Now, looking at the follicular phase, which is mainly controlled by the follicle stimulating hormone, we want to relate it with the ovarian cycle, because the ovarian cycle and the menstrual cycle, they occur concurrently. So the follicular phase is also concurrently occurring with the proliferative phase of the menstrual cycle. So in the proliferative phase of the menstrual cycle, there is multiplication of these follicles till maturity. Then there is production of estrogen and progesterone, which helps in taking in the endometrium, preparing it for menstruation, which now send information to the hypothalamus that the level of estrogen and progesterone is high. So the hypothalamus will now send a message to the anterior pituitary gland to reduce or stop the production or formation of follicle stimulating hormone and the luteinizing hormone. Then down here in the luteal phase, which is mainly controlled by the luteinizing hormone, we have the secretory phase of the menstrual cycle. Secretory phase of the menstrual cycle. And in this, we said physical changes take place on the follicles that have ruptured to release the matured ovum, and there is continuous secretion of these yellowish substances. And this phase, it's being controlled by the progesterone. So once the progesterone level drops as a result of the degeneration of the corpus luteum, a message will be sent to the hypothalamus, and before the proliferative phase, a phase known as the menstrual phase will occur. So the drop in the level of the progesterone will now cause the endometrial lining of the endometrium to shed away. It will slough up as a result of the drop in the level of the progesterone produced by the corpus luteum. So the cycle will now continue. So once the corpus luteum decrease the production of progesterone, the menstrual phase occurs, and then after the menstrual phase occur, which usually occur from 1 to 5 days, then the proliferative phase of the menstrual cycle begin, and that's how the cycle continues. So in summary, we've talked about the ovarian cycle, which is divided into two phases: the follicular phase, which is the first half, and we have the luteal phase. The follicular phase is being regulated or controlled by the follicle stimulating hormone mainly, and the luteal phase is being controlled by the luteinizing hormone mainly. In the follicular phase, we said there is formation of follicles, they develop and get to maturity. In the matured follicle, we said we have presence of Theca cells in these follicles, which produce two ovarian hormones, estrogen and progesterone. So when the level of estrogen and progesterone get to its peak, a message is sent to the hypothalamus, and the hypothalamus stimulate the anterior pituitary gland, and follicle stimulating hormone and luteinizing hormone production will now drop. So after the release of this matured ovum, the remaining other follicles, they degenerate. So definitely the level of estrogen and progesterone drops. Alright, then in the luteal phase, we said the ruptured follicle now become filled up with blood, and it is known as the corpus hemarrhagecum. Then physical changes continue to take place, and a yellowish substance filled up the corpus hemarrhagecum, and it's now known as the corpus luteum. Then the corpus luteum continue to undergo degeneration, and it become corpus albican, which now become the atretic follicle, and it is absorbed by the body. The most important thing to understand at the luteal phase is that there is production of progesterone by the corpus luteum, and this progesterone maintains the thickness of the endometrium of the uterus for pregnancy. So once the level of the progesterone gets to its peak, the corpus luteum undergoes degeneration, and then the level drops, which now leads to the sloughing of the endometrium of the uterus, known as the menstrual phase. And after the menstrual phase, the proliferative phase begins again. So that's how the cycle continues. Thank you. If you have any question or comment or any observation, please don't forget to subscribe to my channel and send your comment.